Now we are going to see some mortality terminology. So we have birth rate. This is the number of live birth per 1,000 total population. We have the fertility rate, which is the number of live births per 1,000 women from 15 to 45 years old. We have fetal mortality rate, which is the number of fetal deaths divided per 1,000 total live births. So first, what is fetal death? Fetal death is a combination of antepartum death and intrapartum death. So antepartum is death of the fetus before labor, exactly between 20 weeks of gestation and before labor, because remember that abortus is loss of a fetus before 20 weeks. So antepartum death is between 20 weeks and before labor starts. Intrapartum death is death of the fetus during labor. Then we have neonatal mortality rate, which is the number of neonatal deaths divided by 1,000 live births. So here, what is neonatal death? Neonatal death, this is death of the baby since the baby was born up to 28 days. 28 days. Then we have the perinatal mortality rate, which is the summation of the fetal mortality rate plus the neonatal mortality rate, fetal mortality rate plus the neonatal mortality rate. In other words, this is the number of perinatal deaths, divided by 1,000 total births. This is because here we have fetal mortality is the number of fetal deaths per 1,000 total births. Oops. Here's 1,000 total births, no total live births, total births. It doesn't matter if at the end the baby was, if the baby died or no. Is the amount of fetal deaths divided by 1,000 total births, no matter if this 1,100 total births is a dead fetus or no. But in the other hand, we have neonatal death, which is neonatal death per 1,000 live births. Here we are talking of just live birth. If we had a death of a baby that was born dead, that is not in this count of 1,000 live births. So in this summation, which is the perinatal mortality rate, which is fetal mortality rate plus neonatal mortality rate, we have total births, because here the denominator is total births. So even though here we're just counting live births, here we count total births because here we are counting total births. And then we have the again, perinatal mortality is the sum of the fetal mortality or fetal death, which is antepartum plus intrapartum death, plus neonatal death, which is from when the baby was born up to 28 days. And then we have infant mortality rate, which is the number of infant deaths divided by 1,000 live births. So again, here we are just considering live births. And infant is from when the baby was born up to 1 year. Another terminology we have is the mortality maternal mortality ratio, which is the number of mother's death divided by 10,000 births. And now to illustrate more the terms of fetal mortality, neonatal mortality, we are going to do a diagram. So this is the timeline of pregnancy duration. And here, 20 weeks gestation, death of the fetus, embryo fetus before 20-week gestation. This is abortion. If we have, let's say here is the due date, here the baby was born, so up to 20-week gestation, up to before 20-week gestation, up to before labor, this is antepartum mortality or antepartum death. Death during labor, this is intrapartum death, this is during labor, up to 1 month, exactly 28 days. So born, when the baby is born up to 28 days, this is neonatal death.